Welcome to our deep dive today. It's going to be all about eye health. Specifically, we're going to be looking at the Ocular Hypertension Treatment Study.
The OHTS.
Yeah, OHTS for short.
Catchy, right?
Yeah. I have to admit, when I first heard the term ocular hypertension, I was picturing like a villain from a comic book or something.
Yeah, it does sound a bit dramatic.
But it turns out it's not that dramatic,
Hmm.
but it is a serious condition.
Yeah.
So ocular hypertension means that you have elevated pressure inside your eye. So it's kind of like high blood pressure, but for your eyes.
Right, exactly.
And this doesn't mean that you have glaucoma yet, but it does put you at an increased risk of developing it.
Yeah.
So that's why we're doing this deep dive, to unpack what researchers have learned from the OHTS and what it means for anyone who's concerned about their eye health.
Absolutely.
So maybe we can start with, what were the researchers even trying to figure out in the first place?
Well, they were tackling some pretty fundamental questions about ocular hypertension, like how often people should be examined. What tests are most effective? Can we actually identify who's at high risk of developing glaucoma versus low risk?
Right.
And how many people with ocular hypertension will actually develop vision problems from glaucoma? Like, how worried should we be about this?
Right.
And then maybe the biggest question is, can we do anything to prevent or delay vision loss? And who might benefit from early treatment?
So are they trying to figure out if intervention is even worth it? Like, should we even be bothering with this?
Yeah, that's a big part of it. And how do they go about answering that question, right? So that's where phase 1 of the study comes in.
Okay.
They enrolled over 1,600 people with ocular hypertension.
Wow.
And randomly assigned them to either receive medication to lower their eye pressure or just be observed. The medication group, their goal was to significantly lower their eye pressure.
Okay.
And they could use whichever medication worked best for them.
So the classic treat versus wait and see.
Exactly.
What did they find? What happened after they followed these folks?
Well, the results after 5 years were pretty clear. The medication group had less than half the rate of developing glaucoma compared to the observation group. So that's pretty significant.
Yeah, it sounds like it.
This was a big deal because it really proved that early treatment could actually make a difference in preventing vision loss.
Wow, that's impressive. So does this mean that everyone with ocular hypertension should be on medication then?
Well, not so fast. It's not quite that simple.
Okay.
Remember, this was just phase 1.
Right.
It showed that treatment is effective, early treatment. But it doesn't necessarily mean it's the right choice for everyone. There are always risks and benefits to consider.
Yeah.
Along with individual factors, like someone's age, their overall health, even personal preferences.
Right, so it's not a one-size-fits-all.
Exactly.
But this finding that early treatment works, that's got to be a game changer, right?
Oh, yeah, absolutely. It really did shift the paradigm. Before the OHTS, there was a lot of debate about whether early treatment was even beneficial. So this study provided solid evidence that it could significantly reduce the risk of developing glaucoma.
So that's huge.
Yeah, it was a big deal.
So, okay, this is all super interesting, but you mentioned that the study also looked at risk factors for developing glaucoma, right?
Right. So, they wanted to figure out who's most likely to benefit from treatment.
Right.
So some of the findings weren't that surprising. As you might expect, older people, folks who had higher eye pressure initially, they were more likely to develop glaucoma.
Yeah, makes sense.
Makes sense. But there was one risk factor that really raised eyebrows.
Okay, I'm intrigued.
It was central corneal thickness.
Okay, now that's a term I need you to unpack.
All right, I'm happy to do it.
What is central corneal thickness? And why does it matter for glaucoma?
All right, so think of the cornea as the clear front part of your eye. It's kind of like a window.
Okay, yeah.
And central corneal thickness is simply how thick that window is.
I got it.
And what the study found was that people with thinner corneas were at higher risk of developing glaucoma.
Wait, so the thickness of your cornea can influence your risk of developing glaucoma?
It can.
That seems like a pretty far-sighted conclusion. Like, how are those two things even connected?
It is a fascinating finding, and it's not entirely clear why, but researchers believe that it might have to do with the structural integrity of the eye. Imagine the cornea as the wall of the eye. A thinner wall might be more susceptible to damage from the pressure inside.
Yeah, that makes sense.
So it's not just about the pressure itself, but also how the eye's structure responds to that pressure.
Okay.
And this finding has really highlighted the importance of personalized care when it comes to managing ocular hypertension. We need to look at the whole picture, not just a single number on a pressure gauge.
Right. Speaking of the whole picture, the study also developed like a model to predict who's most at risk.
They said.
What kind of factors go into that?
Yeah, they came up with a 5-factor model that includes age, initial eye pressure, central corneal thickness, something called the cup-to-disc ratio of the optic nerve,
Yeah.
and visual field pattern standard deviation.
Okay, hold on. You lost me with those last two.
Yeah, no problem.
Break it down. What is this cup-to-disc ratio?
So the optic nerve is like a cable that transmits visual information from your eye to your brain.
Okay.
And the cup-to-disc ratio measures how much of the optic nerve is being cupped or pushed back by the pressure inside the eye.
Ah, okay. So like a larger cup-to-disc ratio suggests more damage to the optic nerve.
Exactly.
Okay, so higher risk of glaucoma.
Right. And then the visual field pattern standard deviation, that just tells us how much variation there is in your peripheral vision.
Okay.
So more variation can be a sign of early glaucoma damage.
So that's like a whole panel of indicators, not just a single red flag.
Yeah.
This risk assessment tool must be super helpful for doctors when they're making treatment decisions.
Yeah, absolutely. It helps doctors assess a person's individual risk and tailor their recommendations accordingly.
That's so helpful.
But the story doesn't end there.
Oh, okay.
Phase 2 of the study looked at what happens when we delay treatment.
Okay, let's dive into that.
Yeah.
What did they find when they compared early versus delayed treatment?
So in phase 2, researchers wanted to see if there were any downsides to waiting to treat ocular hypertension.
Okay.
So they took that group, who were initially just being observed. Remember, they weren't getting any medication at first.
Right.
And they started them on treatment after about 7.5 years.
Okay.
So this created a comparison between those who started treatment early on and those who started it later.
So that's a clever way to study the impact of timing.
Yeah.
So what happened? Did those extra years without medication make a difference?
Well, it turns out they did. The study found that people who delayed treatment had a slightly higher risk of developing glaucoma over the long term, especially those who were considered high risk based on that 5-factor model we talked about.
Right.
You know, age, eye pressure, all that stuff.
So even though both groups eventually received treatment, those who started later ended up with a slightly higher risk.
Yeah.
So that suggests that there might be a benefit to starting treatment sooner rather than later,
Yeah.
especially for those who are more likely to develop glaucoma.
Exactly. It's not a guarantee, but early treatment can kind of tilt the odds in your favor.
Right.
Especially for those at higher risk. It's a little bit like wearing a seatbelt in a car.
Oh, okay.
You know, you might not get into an accident, but if you do, that seatbelt could be the difference between walking away and a serious injury.
Yeah, that's a great analogy. But I imagine there are downsides to starting treatment early as well, right?
Of course.
Like potential side effects from the meds,
Sure.
the cost of eye drops,
Yep.
and just the hassle of having to remember to put them in every day.
Absolutely. You're absolutely right. There are downsides to consider.
Right.
And it's not a decision to be made lightly.
Okay.
That's why personalized care is so important.
Yeah.
You know, a doctor can help weigh those risks and benefits based on each person's unique situation,
Right.
taking into account things like their age, their overall health, any other medical conditions they might have,
Yeah.
even their personal preferences.
Okay.
You know, some people might be more willing to tolerate the inconvenience of eye drops
Right.
if it means significantly reducing their risk of vision loss, while others might prefer to wait and see.
So it's not a black and white decision.
No.
It's about having a conversation with your doctor, understanding the risks and benefits,
Exactly.
and making an informed choice that's right for you.
It's a shared decision-making process.
All this talk about risk factors makes me wonder, wouldn't it be amazing if we had like a crystal ball
Right.
that could just tell us exactly who would develop glaucoma and who wouldn't?
Oh, that would make things so much easier.
Right. That would be amazing.
Well, we might not have a crystal ball yet,
Okay.
but the OHTS researchers, they're working on something pretty close. They're currently in phase 3 of the study, which involves following the original participants for a remarkable 20 years.
Whoa, 20 years. That's some serious long-term commitment to research.
It is.
What are they hoping to learn from this extended follow-up?
Well, one of their main goals is to track the incidence and severity of glaucoma over time.
Okay.
They want to understand how the disease progresses, you know, how quickly it develops, and what factors might influence that progression.
So they're basically watching to see who develops glaucoma,
Right.
how quickly their vision deteriorates,
Uh-huh.
and just what patterns emerge over those 20 years.
Exactly.
That's a treasure trove of data.
It is.
What else are they looking at?
Well, they're also trying to develop a long-term prediction model.
Yeah, okay.
Imagine being able to predict someone's risk of developing glaucoma 20 years down the line.
Wow, that would be incredible.
That would be incredibly valuable for making informed decisions about treatment and prevention.
It would be a game changer, for sure. It would allow doctors to, like, personalize treatment plans
Absolutely.
even further. Focus resources on those who are most likely to benefit. What other mysteries are they hoping to solve with this long-term data?
Well, they're interested in figuring out why some people's vision deteriorates quickly,
Okay.
while others experience a much slower decline.
Right.
If we can identify the factors that influence the speed of progression, we might be able to develop treatments that slow down vision loss
Okay.
for those at risk of rapid decline.
So it's not just about whether or not you develop glaucoma.
Right.
It's also about how quickly it progresses if you do.
Exactly.
And the OHTS is helping us understand those nuances.
Exactly.
Yeah.
And there's another aspect of this long-term study that's really important.
Okay.
Up until now, we've been talking mostly about the clinical aspects of glaucoma, right?
Yeah.
The measurements, the risk factors, the treatments.
Right.
But in phase 3, they're also looking at how glaucoma impacts people's lives
Okay.
beyond just their vision.
Oh, wow. That's so crucial. Glaucoma can be a very isolating experience
You can.
and frightening.
Yeah.
And it can affect people's independence, their ability to work, their social lives,
Yeah.
their overall quality of life.
Yeah.
Understanding those impacts can help us provide better support and resources.
Exactly. It's about treating the whole person,
Yeah.
not just the disease. So they're looking at things like quality of life, ability to perform daily activities, the emotional toll of living with glaucoma,
Yeah.
even the economic impact of the condition.
That's really insightful. It reminds us that behind the numbers and the data, there are real people whose lives are affected by this condition.
Exactly. And by understanding the full spectrum of impacts, we can develop more holistic approaches to care
Yeah.
that address not just the physical aspects of the disease, but also the emotional and social well-being of those living with it.
Well, this has been incredibly informative. We've learned so much about the OHTS, from its initial goals and findings to the ongoing research that's really pushing the boundaries of our understanding of ocular hypertension and glaucoma. But before we get too lost in the weeds here, let's zoom out for a second.
Okay.
What are the key takeaways for our listeners?
Sure.
What should they remember and act upon after this deep dive?
I think the biggest takeaway is that early treatment for ocular hypertension can really make a difference.
Yeah, for sure. I mean, the OHTS showed us that just lowering that eye pressure can significantly reduce the risk of developing glaucoma.
Absolutely, and especially for those who are at higher risk.
Right. And we've been talking about how early treatment isn't the right choice for everyone. There are those downsides, right? The potential side effects, the cost, the inconvenience of the eye drops.
Yeah, you have to weigh those things, for sure. It's not a one-size-fits-all approach.
Right. So what would you say to someone who is a little hesitant to start medication? Maybe they're worried about those side effects, or they just don't like the idea of having to put drops in their eyes all the time.
Yeah, I get it. I mean, nobody wants to take medication if they don't have to. But it is important to remember that untreated ocular hypertension can lead to vision loss from glaucoma, and that vision loss is irreversible.
Right.
So that's the serious part. But the good news is that there are so many different types of glaucoma medications available these days that finding one that's well tolerated is usually possible.
That's good to hear. So it's not just one drop fits all.
Exactly. There are options.
That's good. What about like the technology for the eye drops themselves? Has that improved as well?
Oh, absolutely. The technology has come a long way. Some of the newer formulations require fewer drops per day, which is nice.
Oh, that's great.
There are even some slow release options that are in development
Oh, wow.
that could potentially deliver medication over a longer period, so you wouldn't need to do it as often.
Wow, that would be a game changer.
It would be a game changer.
Less hassle and hopefully better compliance with the treatment.
Exactly.
Even with all these advancements, the decision to treat or not to treat, that's ultimately a personal one, right?
It is. And it should always be a shared decision between the doctor and the patient. You know, the doctor can provide all the information, explain the risks and benefits, offer recommendations, but ultimately the patient needs to feel comfortable and confident in that decision.
Right. It's about empowering patients to make informed decisions about their own health.
Exactly.
That's really what this whole deep dive is all about.
That's right.
So beyond the treatment decision, what else can listeners do to protect their vision?
Well, one of the most important things anyone can do, and this is whether they have ocular hypertension or not, is to schedule regular eye exams.
Okay.
Early detection is key. And that's not just for glaucoma, it's for a whole host of eye conditions. And for those with ocular hypertension, those regular checkups are so important for monitoring the condition and catching any changes early on.
So it's kind of like going to the dentist for regular cleanings.
Right.
Even if your teeth don't hurt,
Exactly.
it's better to prevent a problem than to deal with something bigger later on.
Exactly. And don't underestimate the power of being your own advocate. If you have any concerns about your eye health at all, you should always ask questions.
Yeah.
That's what doctors are there for.
Absolutely. It's a partnership. Speaking of knowledge, one thing that stood out to me from the OHTS was the finding that African Americans have a higher risk of developing glaucoma,
Yeah.
even when other factors are considered. Like, why is that?
That is a complex question,
Yeah.
and we don't have all the answers yet. But the OHTS did offer some clues.
Okay.
It found that African Americans in the study were more likely to have thinner corneas and larger cup-to-disc ratios, which are both risk factors for glaucoma.
Mm-hmm.
So that suggests that there may be some biological differences at play. But more research is definitely needed to fully understand those underlying causes.
Right. So it's not just a matter of like lifestyle or environmental factors.
Yeah, right. It seems like there's a biological component as well that increases the risk for this population.
And it's important to remember that everyone is unique. While the OHTS identified this difference between racial groups, we should avoid making assumptions about individuals based solely on their race. Everyone deserves personalized care that's tailored to their individual needs and risk factors.
Absolutely. I completely agree.
Well, this has been an incredible journey, really enlightening. We've learned so much about ocular hypertension and the groundbreaking OHTS study. But as we wrap up here, what's the final message you'd like to leave our listeners with?
I would just say, take your eye health seriously. Ocular hypertension and glaucoma are serious conditions. They can lead to vision loss, but with early detection, proper management, and a proactive approach, you can protect your precious eyesight and enjoy clear vision for years to come.
Beautifully said. And remember, folks, if you're feeling a little overwhelmed by all this information, don't hesitate to reach out to your eye doctor.
Yes, absolutely.
They're your trusted guide on this journey. They're there to answer your questions, address your concerns, and help you navigate the best path forward for you.
They are.
Thanks for joining us on this deep dive, everyone. We hope you found it informative, insightful, and maybe even a little bit eye-opening. Until next time, stay curious, keep learning, and keep those peepers healthy.